Welcome back to the Ear Doctor. Thanks for watching my videos. So here we have this pleasant lady who develops a lot of earwax and visits my clinic pretty much every 6 to 8 weeks. As you can see with the suction tube, I'm trying to lift the hard impacted wax from the edges of the ear canal. Lifting the earwax from the edges of the ear canal will then enable me to use the crocodile forceps and gently grab hold of the earwax and remove it from the ear canal. You have to be very patient when performing this, and obviously keep an eye on the patient to see if they're in any discomfort or not. And as you can see, the earwax plug is gently removed, and it's a substantial size. The patient instantly felt better, and any remaining bits were removed with the suction. Now we move on to the other ear, and a very similar picture here. So we gently try and lift the earwax from the edges of the ear canal. We then use the crocodile forceps to gently peel it off, and slowly but surely the earwax will come out. You must be careful not to cause any further injury, and also keep an eye on the patient again. This piece of wax was just being difficult, but eventually, as you can see, a much larger piece. Suctioning this side did reveal a small central eardrum perforation, and the patient did admit to using Q-tips or cotton buds to clean her ears. Nevertheless, with a fine suction tip, we removed the remaining earwax and dead skin, which was very close to the eardrum. This patient was given further advice regarding her eardrum perforation. Thank you for watching, and follow for more videos from the Ear Doctor.